TMD, the dysfunction of the TMJ, it's a difficult one. I've never found the silver bullet that solves everybody's problems. A lot of people feel that a lot of their joint problems or their clicking or their grinding is either stress related, but a lot of it can just be normal everyday life. It could be deformalities just anatomically. I have found it interesting to try different things, either physical therapy wise, chiropractically wise, and dentally, to kind of restore the mouth to help put the joint, the TMJ, in the proper position so it can function better. It's a tricky thing though, because there's a lot of factors that come into it. There's a lot of different ways to get to that end point, but a lot of times we really, find a way to get there, and it's really rewarding for the patient to be out of pain, and for us to provide that for them.